Well, the program, of course, began with a single person, myself, and of course, over the years, we were fortunate to have a number of very talented students initially joining the program, and now, of course, a number of full-time staff. The program has grown actually significantly from its base a number of years ago. We've started really with the anchor points surrounding a number of issues of globalization and health equity. And perhaps the most important area that we focus on, of course, is innovation and access to health technologies, particularly for those in developing countries and also those in resource-limited markets, including those in the States. We work on a wide range, actually, of entry points for policymaking in this area. So the program does, in fact, not only do the usual teaching function, but also engages in research and policy convenings in this area. We're interested in a full range of healthcare technologies. I think that certainly medicines, biologics, such as vaccines, and diagnostics are all part of, I think, fall under the rubric of health technologies that concern us. The policy issues, of course, are equally, I think, broad in the sense that we are as concerned about tiered pricing and how actually can affordable pricing be made available for those in developing countries, as well as also the innovation and R&D pipeline. How do you actually reshape research and development in a way that actually, at the end of the value chain of R&D, we get a product that's affordable and actually appropriate for these resource-limited settings. I think this is obviously one of the great challenges of our time, in that certainly health care technologies, the expectations of the life-saving technologies crossing borders is something that, of course, comes with the globalization we have in the world today. The challenge, of course, is getting the products to follow to those in need. And I think that's one of the great challenges that, of course, many in the world, and our program in particular, focuses on. And it's been the story of HIV/AIDS drugs. 10 years ago, it still is a problem today. And of course, tomorrow we are facing a whole range of new technologies that we hope, in fact, will also reach those who might need such access in developing countries. Oftentimes, we have not thought traditionally about how the innovation process does, in fact, shape the environment for which actually we're going to be having access, conditions for access for those in need after the product, an invention actually reaches the marketplace. And the reality is that we actually need to think about these sorts of issues up front. We need to consider what are the key building blocks of knowledge, where are the royalty stacking that will be happening on the pieces that comprise a particular invention, whether in fact the health technology in the end will be affordable within the resources of the target community that we're trying to serve. Many of the challenges also are not only, of course, affordability alone. We need heat-stable vaccines to reach places where there's not refrigeration to carry the vaccine or the drug all the way through the cold chain to the point of delivery in a clinic in a rural or remote area. For all those reasons, we need to figure out ways in which the innovation process matches the needs for access and conditions of access of those whom we're trying to serve.